Leadership here, we want to share an announcement that is very important to us and we're very excited about. I would like to recognize some of the special guests that are in attendance today. We have Premier Jason Kenney, Minister of Health Tyler Shandro, Minister of Education Adriana LaGrange, MLA for Red Deer South Jason Steffen, City of Red Deer Mayor Tara Veer, our Central Zone Chief Zone Officer Janice Stewart, our Zone Medical Director Jennifer Bestard, our Local Facility Medical Director Dr. Michael Mulholland, the new Senior Operating Officer for the Red Deer site Kimberly Story, the Chair of the David Thompson Health Advisory Council Carol Tkach, as well as the Red Deer Health Foundation CEO Manon Theriault and Rochelle Belzarowski from the Friends of the Hospital. I'd also like to recognize all of the experts, clinical planners, physicians. We had many meetings in terms of planning the expansion and the redevelopment of the hospital, and so there are a whole range of people that aren't able to be with us today or wouldn't actually fit in the room. We want to recognize those because they were instrumental in bringing this planning to the point where we're at today. At this time, I'd like to invite Premier Jason Kenney to the podium to deliver this exciting news.
All right. Thank you, Alan, and thank you so much to the entire Red Deer Regional Hospital Centre community for welcoming us here today. Delighted to be here with Minister LaGrange, MLA Steffen, Minister Shandro, and Mayor Veer, members of council, and especially many of the tremendous women and men who deliver health services to Central Albertans every single day. And you bring great compassion, professionalism, and skill to each department and clinic at this hospital. And we're all happy to be able to support you in what I fully understand is a challenging environment. You all know that this hospital is one of the busiest in the province. It's also the only care centre in the central region with a full spectrum of surgical specialties, advanced diagnostics, and critical and emergency care. Half of the patients seen here are referred, I understand, from outside the city of Red Deer, mainly from elsewhere in central Alberta. Because of that and the city's population growth, this hospital has been operating, I gather, at 100% of its capacity or more for some time. And as things now stand, this is a difficult burden for everyone to bear. It's hard on the dedicated doctors, nurses, and other care providers who work around the clock to diagnose, treat, and comfort patients. It's also tough for patients themselves, many of whom are in pain or dealing with chronic conditions who face sometimes long waits here or long trips to get critical care elsewhere. But the pressure is only going to increase because the population in Red Deer is forecast to grow over the next couple of decades. And I certainly hope it does with economic growth. Both patients and medical staff deserve better. They need a world-class facility that delivers world-class care results and reflects the demands that will be placed on this hospital in the future. Now, for years, people in central Alberta have been calling on the province to get improvements underway. Past governments wasted time on half measures. This government of Alberta will get the job done. I'm pleased to announce today that the government of Alberta is funding a major expansion of the Red Deer Regional Hospital Centre. Today, we are announcing the first phase of the expansion of the Red Deer Regional Hospital with a commitment of $100 million that has been authorized in the province's capital plan. We are going to begin with consulting Red Deer residents, Central Albertans, and of course members of the hospital community to determine the priorities and services that residents expect from this phase one of the expansion. That consultation, planning, and pre-construction work, some of which has been underway, will be funded by a $5 million commitment in this year, in fiscal year 2020-2021. Now, let me be clear, the budget to be tabled yesterday doesn't show the full $100 million over the course of the horizon of this budget, but I have given instruction to the Departments of Health and Infrastructure to move forward as much of the $100 million to be spent as quickly as possible to get construction underway. And I can confirm that, the bottom line is construction work will begin on the expansion and the refurbishment of the Red Deer Hospital next year in 2021. So I want to commend MLA Stephan, Minister LaGrange, as well as Mayor Terravere, for having raised these concerns consistently. I've spoken to these individuals. They are passionate representatives of the interests of Red Deer residents and Central Albertans, and they've made it absolutely clear that Red Deer cannot wait, which is why I have given instructions to our relevant ministers and the public service to accelerate this work as quickly as possible, more quickly than will be reflected in the budget documents tomorrow. We want to get this done, but we need to get it done in the right way. Some of you may know what happened with the Grand Prairie Hospital. We do not want that sad story to be repeated here in Red Deer. They were double over budget, and it's now been nearly a decade. And I understand that was partly because some of the planning work was rushed, and then there were changes in the planning. So I plead with the Red Deer Hospital community to work with AHS and Alberta Infrastructure to make sure that this year, in the planning and pre-construction phase, we get it right. So we proceed thoughtfully, as quickly as we can, but to ensure that the work is done on budget and on time. And I emphasize that this is phase one. We know that in the long term there will be additional need for resources, for refurbishment and expansion. We hear that message. MLAs LaGrange and Stephan and Mayor Veer have made that absolutely clear to us. We hear you. And as we can, we're working forward. This government's been in office for only 9 months. We inherited a capital plan that had largely been locked in already. This was not in that capital plan. This had been removed as a priority in that capital plan. We have put this back in to the provincial capital plan with the initial investment of $100 million. And as we work through these issues, as we complete our consultations, and hopefully as the province's fiscal health improves, we will seek additional investments for additional phases of the expansion and refurbishment of this hospital. So you have our commitment on that. Now, today's announcement reflects that even at a time of great fiscal challenge, that the Government of Alberta continues to invest in critical infrastructure, particularly in our healthcare system. Tomorrow's budget will reflect an investment of $6.4 billion in capital spending in the forthcoming fiscal year, even while we seek overall to restrain spending with overall spending reductions of 2.8%, because we have the largest deficit in Canada. If no action is taken, we're headed to over $100 billion in debt. And we do not want to trap ourselves in a future where we are spending billions and billions more tax dollars on interest payments on the debt, because that means less money available for healthcare, infrastructure, and education. So all of us as Albertans need to work together, and especially in the healthcare sector. I know Minister Shandro will speak to this, but let me be clear, because many people here work every day, sometimes heroically, to deliver care to patients. You do the most important work in Alberta. We honor and value that work. The Government of Alberta and Alberta taxpayers are there to support you. We are actually increasing modestly the overall budget for healthcare in Alberta. Currently, we are spending the highest level in our province's history on healthcare. We are not reducing the healthcare budget. We will be challenging our system to operate more efficiently, to identify better ways of doing things, to identify inefficiencies so that we can then spend that money where there are the greatest cost pressures and the highest priorities. And I know that our great medical professionals are up to that task. So thank you to Alberta taxpayers for funding this project. Sometimes it always irritates me. Politicians try to take credit for these things. It's the folks who work every single day, who pay their taxes, who fund projects like this. And a lot of those folks are under economic pressure. Their incomes are down, and a lot of those folks are challenged. But I want Albertans to understand that we intend to use their tax dollars wisely, and I cannot think of a wiser investment than in critical health infrastructure in overburdened hospitals such as this. I'm deeply grateful to the physicians, nurses, practitioners, and administrators here for your patience and your perseverance. And my promise to you is that Minister Shandro, Minister Panda at Infrastructure, and their teams will get the jobs done as quickly as they can to lighten your load, increase capacity, and change things for the better. Thank you very much.
Thank you very, very much, Premier Kenney, for the dedication, the commitment, and the money towards this project. This is absolutely fabulous. We're delighted. And as the Premier noted, this is a very, very busy hospital. He noted that 50% of the patients in the hospital on any given day are coming from outside of Red Deer itself. Part of the reason is we have that concentration of specialties that doesn't exist anywhere else in the zone. We have ICU and a CCU that sees some very intensive patients from all across the zone. We're the only site that has higher risk obstetrics and a NICU for the neonatal patients. We've got the higher intensity MRI, the nuclear medicine in that diagnostic imaging where really the patients can't be served in the rural hospitals that we serve. In fact, of the 30 hospitals in the central zone, 15 of them, their number one place to refer to isn't Edmonton or Calgary, although we do go there for the tertiary and quaternary services we have to go to there for. But 15 of those hospitals, their place to refer to, the number one place, is here. We are the phone-a-friend for those rural hospitals. So I'm really, really pleased that we're seeing this announcement and this commitment today for the hospital that serves the entirety of the central zone. So now, after the Premier's speech, I mean, he really knocked it out of the park. I'm wondering who's going to speak next, and it happens to be our Minister of Health, Tyler Shandro.
Well, thank you, and good morning, everyone. And thank you, Premier, for making the time to be here to make this fantastic announcement for the people of Red Deer and Central Alberta. And thank you to the whole team here at the Red Deer Regional Health Hospital, Hospital Centre. And thank you, as Premier said, to Mayor Veer, to my colleagues, Minister LaGrange and MLA Stefan, for being here as well and being so instrumental in being able to advocate for their community to be able to get this announcement to this place. As Alan said, I'm Tyler Shandro. I'm very deeply honored to be your health minister. What an exciting day for Red Deer and for all the patients and families who rely on this facility. Since I became health minister, the residents of Red Deer have repeatedly asked for more funding to start improving the Red Deer Hospital. As Premier noted, and as anyone who has waited in this facility can attest, this is an incredibly busy facility. For years, the people of Red Deer have been calling for government to step up and take action. Physicians have called for improvements. Patients have called for improvements. The local MLAs, my colleague, as I said, Minister LaGrange and MLA Jason Stefan have passionately advocated for more funding. As Minister of Health, I'm so very, very proud to join our Premier in announcing today's capital investment into this hospital. Our government's listened, and now we're going to deliver. This funding will expedite planning work to finalize the project scope requirements, the construction schedule, capital costs, and potential operating budgets. These are important steps, and they would have been finished years ago if previous governments had made this a priority. This funding is a $100 million promise to Red Deer that we will get it done right and that we will get it done as soon as possible. We're making long-term capital investments in this hospital and other facilities to keep Albertans healthy. And at the same time, we're keeping our campaign commitment to hold the line on operating and strengthen our universal, publicly funded healthcare system. Past governments have thrown more and more money at the system without always getting better results and without expanding the Red Deer Regional Hospital. We need to be willing to invest for the long term. But in terms of operations, we believe there's enough money in the system, as Premier said. We're spending $22 billion this year, more than ever before, but we need to get better value for that $22 billion. And so we're working with AHS and making decisions in every part of the health system to find efficiencies, not to take money out of the budget. Every dollar that we save will stay in the system, but to reinvest in improving access and making the system work better. That's our commitment to Albertans, to make long-term investments that we need and manage the budget better to get costs under control and to deliver better results. And it's about one thing: a stable, publicly funded health system that's there for every Albertan when they need it. The people who work here know all about being here for patients when they need them. That's the promise of our health system. Every patient who walks in through the doors downstairs gets the care that they need. And they get treated with respect. Everyone. They trust the people at this hospital and across the system to take care of them. That trust is the real strength of our health system here in Alberta. And it's the foundation that I'm building on in everything that I do as the health minister. So thank you again, Premier. Congratulations to all for the to all of the incredibly dedicated people who work here in this facility. And my best to all the patients and families who are here in the hospital right now or will be in the future. You are in good hands. Thank you so much for having me. Thank you.
So thanks again to Health Minister Shandro for your commitment to this project. The path that we're setting out here today is a long one. We will need to be working with our government partners and our internal groups on the redevelopment and growth of this hospital. Working with our government partners is a lengthy process, as we've noted, and there will be a significant amount of interaction with our staff and with our physicians. What we want to make sure is that we're working on a project that's not just fixing the four walls, or in this case, the multiple walls of a building such as this, but also is expanding and moving care into the community, because we know that's where we need to have it. We need to enhance both for the benefit of patients in the area. So now, from the AHS perspective, I'd like to call upon Janice Stewart, the Chief Zone Officer for Central Zone, to come forward with a few notes.
Yes, hi Janice, great to see you.
Congratulations, Janice. Good morning, everyone. I am so pleased to be here this morning and so pleased that you could all join us for this very important announcement today. Thank you, Premier Kenney and Minister Shandro, for making it a priority to be with us today to make this announcement. Redevelopment of the Red Deer Regional Hospital Centre has been a priority for those in this room and many more, including our valued staff, our physicians, our volunteers, and our elected officials on City Council. Thank you, Mayor Revere, for being such an advocate for us. Community members from Red Deer and beyond. We are very grateful for this government's financial commitment to help ensure that the only regional referral site for Central Zone will continue to be able to provide safe, accessible, and sustainable care for Albertans for years to come. Red Deer Regional Hospital has experienced significant growth, as you have heard this morning, in patient acuity and in its role as the regional referral centre increases. And we know that growth for acute care services at the hospital is necessary, and planning to date for the redevelopment of the site has identified a number of key important things that need to be done. These include increasing our inpatient beds, increasing our operating rooms, expanding our cardiac program, enhanced diagnostic imaging capacities, and expansion of ambulatory care services. Of course, physical expansion of the hospital is one piece of a much larger puzzle. Community-based care also needs to be enhanced to reduce the need for hospitalization and to provide support for patients after they are discharged. We need to ensure that we are also working in the community to address risk factors that contribute to the higher incidence of illness, and particularly heart attacks, which we see in the Central Zone. We need to ensure that we are working to enhance prevention, disease management, support in the community, and improved access to primary care providers so that we can help Albertans prevent and manage conditions long before they require hospital care. If we can influence those risk factors, such as smoking, obesity, chronic disease management, we can have an even greater influence on the mortality of people who suffer from heart attacks. Part of the redevelopment planning work will include finalizing recommendations on the expanded campus of care, which will include a list of services that could be appropriately located into the community elsewhere. Exploring opportunities to move forwards for more community-based care to keep people well and out of the hospital and return them home more quickly following a hospitalization will be an important part of the health system in Red Deer. By focusing on wellness and prevention, we can not only provide better patient experience and positively impact the outcomes of health, we can also improve the access to the hospital itself when care is needed. And when that care is needed, the residents can be assured that they will always receive high-quality care here at the Red Deer Regional Hospital Centre. On behalf of the leadership team, Dr. Besner and myself, we here in the Central Zone would like to say thank you to our staff, our physicians for their dedication and their commitment to our patients, and thank you again to the Government of Alberta for your commitment to our hospital and our community. Thank you.
And thank you, Janice, for those words. As you heard Janice say, this is a fairly detailed process to work through. Expanding or adding any new health services requires careful and detailed planning. In the past, we have worked with our physicians and our local groups, and we will do so again. We'll do so starting very soon. We've already started to have some discussions around the business case, and that patient and community voice is one of the key things that we've already started to discuss, how we'll make sure that is part of the planning. I would like to ask all of our speakers this morning to come up to, I believe, the back here for a photo, and then there will be an opportunity for questions and answers after that. And thank you for you all for attending here today. Thank you.
Mind me usurping your MC duties, I'd like to invite the Mayor to say a few words as well.
Red Deerians, Central Albertans, our fellow Albertans, let it be known that the people have been heard. On behalf of Red Deer City Council, the City of Red Deer, the citizens we represent, and this incredible region that we serve, we want to extend our community's incredible appreciation to our Premier, to Minister Shandro, to their colleagues in Cabinet, to our local MLAs and incredible advocates, MLA Stephan and Minister LaGrange, for this significant investment in the Central Zone today. We know that for many, many years, the people of Red Deer and Central Alberta have been united in our message for improved health outcomes for the people in our community. We have identified the infrastructure expansion and investment and programming investment at the Red Deer Regional Hospital Centre as a top priority for the people of Red Deer and Central Alberta. The government has heard us, and we are so deeply appreciative of the government's responsiveness on this file that there is a funding commitment this year, and their further commitment that they will work with the people of our community as we move forward. This victory belongs to the people of Red Deer and Central Alberta, to the many frontline service providers, administrators, staff, physicians, nurses who have publicly shared their stories and who have courageously identified the need for infrastructure expansion and investment in our community. But above all, this belongs to the patients who have publicly shared their stories, who have written letters and made phone calls, and who have been unwavering and steadfast in their commitment for better health outcomes for the people of our region. We all know that the lives, the health and wellness of our loved ones matter most. And when we united as a community, we know that we are positioning Red Deer and Central Alberta as the health centre for the people of our province. And today's news is not only great news for the people of Red Deer and Central Alberta, but the people of this great province that we are so very fortunate to call our home. We know that as the primary referral for every Albertan travelling along the QE2, that this infrastructure expansion will benefit every Albertan. And we also know that it will build capacity in every other hospital throughout our great province. And so today's news is really great news for the people of Alberta. Thank you, Premier. Thank you, Minister. Thank you to the Government of Alberta on behalf of our community. This belongs to you.
So that concludes the formal programming for today. We will now have a brief Q&A with Premier Kenney. I would please ask that you keep your questions to one question, one follow-up, as we do have a bit of a timeline to maintain. And I will be jumping to some callers at one point as well. So thank you.
Sorry, I'm hiding behind the tree right here. Mr. Premier and Mr. Shandro, whoever wishes to talk about it, a lot of the push in the last number of years has been talking about a cath lab. I know that it sounds like there's some work to do before we figure out exactly what's going on here, but how much of the intent here is to have a cath lab and expand it into the hospital?
Yeah, so a cath lab is going to be part of the plan. I don't know when that's going to come, and that'll have to come or be determined when we start the design process and what the timing would be. But last year we did complete a clinical services plan. I think it was completed in July. And so that is included in this first phase of this $100 million. But it would just be a matter of us then being able to finish the planning with infrastructure to determine when that would be.
With that $100 million, I mean, there's obviously a great number of things that could be included in $100 million. There's probably no shortage of money that people wish to spend. How much of that cath lab and some of those other high priorities do you think could be accomplished with that $100 million?
No, that's going to have to happen during the design process, and we're going to have to answer those questions. And then that's why, as Premier said, we want to make sure that we're doing it as quickly as we can. So we're going to try and finish the work with Minister Ponda's ministry, with infrastructure, to be able to move up as much of that process as we can. I think by September, if it can be done earlier, that's great. We'll be able to understand some of the scope. Questions will be answered from Mr. Ponda's ministry, and then we'll be able to proceed with working with the community as quickly as we can in the design process.
The Premier, please.
Sure, go ahead. Shoot.
Given how much lower the price of oil is today than it was in the Lougheed era, how wise an investment would it be for the government to invest in the energy sector?
Well, it is essential that we have a future for our largest employer, job creator, and asset. Alberta has the third largest oil reserves on Earth, 178 billion barrels of proven and probable reserves, at current prices with a global market value of $10 trillion. but it's worth nothing if we can't develop it and get it to markets. And what we have is we've been disrupted by politics to block those resources, to landlock Alberta. We've seen the cancellation of $150 billion of prospective investment in Canada's energy sector in recent years. But this week, the Russians announced $150 billion of investment to develop their oil reserves. So the government of Alberta will not allow people who are foreign-funded activists to landlock this province. And so we are open to making prudent, strategic investments to ensure the future of energy resources in this province. If we do not continue to develop those resources and sell them to global markets, then we cannot afford to pay for some of the world's best healthcare. We can't afford the capital budget that we have. We can't afford to continue having the most expensive healthcare system in Canada. So if we want to maintain our standard of living as Albertans, we've got to push back and get that energy to markets. And we need to send a message to the foreign-funded activists that are trying to give OPEC and Russia a pass by shutting down Canada's energy, that they will not succeed.
About your plan. What signals have you received about it?
Well, a significant interest. Just 2 hours ago, I was speaking to the Indian Resource Council, to dozens of First Nations chiefs and Indigenous leaders who desperately want their people to be partners in responsible resource development, who were devastated with the Teck mine decision of this past Sunday, who were deeply frustrated with the cancellation of Northern Gateway of Energy East, who are opposed to the federal bill, No More Pipelines Bill C-69, and who gave me a standing ovation for my expression of solidarity on behalf of the government of Alberta with using resource development as a tool for real economic reconciliation. And they approached me to say they want to be partners with us should we make strategic investments to ensure a future for jobs and the economy in Alberta. And all I can tell you at this point is we are focused on one major project, the details of which I cannot yet discuss because it's not yet completed in terms of the legal and commercial work. But news will be forthcoming, and I think Albertans will see that we are making wise investments in a future of decades for jobs and wealth for this province.
Folks, just because we are running a little bit behind today, we only have time for one more
and
question.
we're not being. Normally, I take every question there is, but I've got my first question period starting, and we're going to have to maybe go slightly over 100 clicks an hour to get there as it is. So
if there's one more question from the floor, we can take that, or we can jump to the phones.
Yeah, I've got one.
We're good.
Sure.
All right. Thank you very much. Thank you, everybody from the Red Deer Hospital. Thanks to all of our elected folks, and look forward to being here next year to see shovels in the ground. Right, Tyler? All right. Thank you very much.